Washington's been on everybody's mind for the last 9 months, and there's been a lot going on. So we have an amazing panel to help us make sense of all of that, led by Jim Greenwood. He was with DLA Piper. He's retired now as a senior policy advisor. But more importantly, he was 15 years as the past president and CEO of International and represented Pennsylvania in the House of Representatives for a long time, also served in the state legislature. He's joined by Bridget Mackolin from EisnerAmper, Maria Tripplaar from Ballard, Spahr, Kevin Batche from IPS-Integrated Project Services, and Anjali, you're going to have to help me.
Rajadhyaksha.
There you go. Okay, from Temple University, Center for Substance Abuse Research. Join me in welcoming them.
All right. Good morning. So I'm Jim Greenwood, by the way. When I was at Bio, I used to say that there are no laws of nature that can prevent us from ultimately being able to prevent, treat, cure every disease known to man. But there are laws of man that can prevent us from succeeding at that. And there are lots of them, unfortunately. And so a lot of what we did at Bio when I was there was to try to figure out how to create a policy environment that's conducive to biotech and life sciences innovation. So just as a little bit of a prelude here, the Trump administration and 119th Congress have served up a series of new laws, new regulations, new executive orders, new actions by the departments of the federal executive branch. And it's been a rather, frankly, chaotic roller coaster for the life sciences industry and created a great deal of uncertainty. Before we get into the one big, beautiful bill, known in various quarters by different names, I want to just note one executive order that's very pertinent right now, and that is that the president issued an executive order in which he, quote, urged pharmaceutical companies to provide, to lower their prices to that of the lowest price that they offer in a series of developed countries around the world. That kind of thinking is common among politicians who fail to understand anything about why it is that companies have to sell in single-payer systems at the price that the government will approve. The fact that we lead the world and innovate more drugs than the rest of the world combined is because we have something close to a free market, a lot of restrictions on it. But what they don't understand is that if the companies sell at those prices in those markets because they can make a small margin, but that margin would never be enough to attract the kind of investment that it takes in an industry that fails 90% of the time. Now, what he said was that by September the 29th, coming right around, he sent a letter to 17 pharmaceutical companies and said by the 29th of September they must commit to these most favored nation prices, or he will, quote, use every tool in the executive arsenal. I think the fortunate thing is that he doesn't have any tools in his executive arsenal to make that happen, which won't prevent him from trying. But I think that this will be, if it's not already, I haven't checked, be litigated by the pharmaceutical industry, and they're not going to stand for it. And hopefully the courts will basically conclude that this is an issue for the Congress and not an issue for the executive branch. We saw in the Inflation Reduction Act under Biden that there were price controls in the Medicare program, but that was done by Congress, which makes it legal and constitutional, but what he's proposing is not. So with that, we will go to the One Big Beautiful Bill Act, which is signed on the 4th of July by the President. Among the bill's greatest impacts is the estimated $1 trillion cuts in Medicaid expenditures and changes to the Affordable Care Act that are expected to eliminate healthcare coverage for 10 to 15 million Americans by 1934. So the question is, how will this impact the life science companies? How will it impact the 340B program, rural hospitals, and hospitals with high levels of uncompensated care and patients assistance programs? And can you answer all of that in about 30 seconds, Maria?
I will see how much I can answer, and I cannot promise you 30 seconds. So the biggest piece is that instantly, once the One Big Beautiful Bill Act was signed,
Does she need to hold her mic up a little bit more?
sorry about that, guys. Once the bill was signed, enacted, instantly we saw 10 to 15 million uninsured individuals in this country that had not previously been uninsured. And that's about a $20 billion impact on the industry. So that was an incredible immediate reaction because of those provisions. The other component of that is that Medicaid patients typically use more pharmaceutical products than other Americans because of the nature of their chronic diseases. And so we will see that the impact is cascading over time because of that. And then, as Jim indicated, when we look to rural areas and southern areas, we will see a greater level of impact. Some of that is just based on geography, some of it is based on demographics and older population, what have you. But the impacts are layered, if you will, which makes it complicated to anticipate as an industry, in my opinion. The other piece of this, of course, is with the increased number of uninsured, it's very likely we'll see a higher reliance on generic forms of pharmaceutical products simply because of the lower price point. And that's something that the industry is also going to need to take into consideration. When you look at 340B, you'll see that the program scale is significant. And I have my notes here because I wouldn't remember these figures. You'll see that it covers over 50,000 healthcare sites so that are serving low-income patients. It generates over $40 billion annually in pharmaceutical discounts, and it is a critical source of revenue for safety net participants. I would expect that we'll see reduced eligibility restrictions, and that will look to probably a 20 to 30% reduction. And then contract pharmacies will also be impacted. So if you do business with a contract pharmacy, that's something to keep in mind. And that manufacturers are facing pressure to continue to limit their 340B pricing on fewer products. So those are all components to keep in mind. And of course, again, circling back to rural entities are most likely to face the greatest impact. And one of the larger pieces of conversation within the One Big Beautiful Bill Act negotiation in Congress was the impact on rural hospitals. And that was one of the points where we did see some concessions made. It's an open question and with very strong opinions on both sides as to whether those concessions went far enough. But I think the big piece there is with the decrease in revenue, we are likely to see that those hospital systems, many of them are likely to face closure. And if not closure, significant restructuring, either in how they're going about their business or in scope. And so services may be impacted as well as those hospitals look to see what is their core business and how can they make adjustments to account for the decreased income.
Thank you. Two points. One is on the rural hospitals. There is $50 billion in there that's meant to help rural hospitals bear the brunt of all of this, but it's not nearly enough. And so you're quite right that hospitals will close. The other thing, if you look at the Medicaid issue, the center of it is, well, if you're between, I think it's 18 and 54, something like that, and you're on Medicaid, you have to demonstrate that if you're physically able to, mentally able to, you have to be trying to work and working. And that sounds like a good idea. Why should somebody who's getting free health care from the taxpayers and is perfectly able to work, sit around and do nothing? However, if you look at the statistics, the vast majority of people on Medicaid are working. They're not but the problem is they're not working. They're working at jobs that don't pay enough to that pay so low that they still qualify for Medicaid. And so you might say, well, then okay, if they're working, and those who aren't are often they're caretakers for their parents, for their children. They're in school. They have other reasons why they can't work full time. But the problem is that even if those who are working, they have to demonstrate, I think it's monthly, but periodically they have to demonstrate that they are in fact working, which means they have to do paperwork and send it in. Well, you know, no aspersions on the people on Medicaid, but many of them are not the most well-educated. They don't necessarily have computers at home. They don't necessarily have the capacity to, on a regular basis, keep up with these certifications that they're working. And so a lot of the estimation as to those who will leave healthcare will be just those who cannot figure out how to regularly comply with that requirement. So the Act also...
Sorry, Jim, if I could just break
Yeah, please.
Just some additional color commentary on that. Because I would say when Congress was negotiating, full disclosure, I'm a federal lobbyist, so feel free to accuse me of being a part of the swamp or a part of the problem or what have you. But the challenge when Congress was negotiating this, and where I think the lines truly ended up being drawn, is that Congress was looking to make cuts regardless. And so the conversation became, should Congress make cuts to the services provided, or should Congress make cuts to eligibility? And it became a diametrically oppositional challenge, because the conversation was, it can't be maintained in its current status, the proponents of reform. And so it was, well, if we maintain the exact population we have now, services have to be cut. Or we can alter eligibility and not produce services to the most vulnerable. And that was where the tension was, and that was how the current structure was arrived at. And unfortunately, some eligibility was sacrificed to maintain full services.
Okay. This is a question for you, Kevin. Will the Act succeed in creating sufficient incentives to expand domestic biotech manufacturing capacity and repatriation of offshore manufacturing? As we all know, one of Trump's main thrusts is he wants to bring manufacturing back to the U.S., and that includes pharmaceutical manufacturing, much of which has moved offshore because of incentives that have been placed in places like Puerto Rico and also in Ireland. So do you see the incentives sufficient to bring this manufacturing back to the U.S.?
Yeah, I think what we've seen from the bill and the provisions in the bill that actually attract manufacturing back to the domestic U.S., there's a number of basic tax incentives in there for biotech and pharmaceutical manufacturers. So one, they can now deduct the full cost of qualifying facilities in the first year. So that's a tremendous difference from what they experience now with the write-off. Secondly, they're able to fully deduct eligible R&D expenses, which is another valuable tax incentive. And finally, there's a complete deduction for R&D equipment, which is a big part of what our biotech clients and manufacturers are looking at. Their labs, their x-ray equipment, their scopes, other things. So is it enough? Yeah, so the basic premise was, is it enough to overcome the tax or the tariff situation, which keeps going up and down, and we've been chasing that really prior to now. I mean, the pandemic brought this reshoring effort and domestic supply chain back. But I think the real proof is in the biotech pharmaceutical industry in the U.S. So currently there's $250 billion in committed spend on capital projects within the United States. So that being said, I think there's a lot of pieces that go into making that decision, maybe not just the bill, but the bill does enable them to put down those facilities and take tax advantage of them a lot earlier.
I think the obvious question is, if you bring manufacturing back into the U.S. and you have to spend all the money you do to build the factories and all of that, and including tariffs on the materials you're going to need to build those factories, right, in the first place, and you lose the incentives that you're getting to lower the price of manufacturing outside of the U.S. And then on top of that, you squeeze down prices in a variety of ways. At the bottom, I can't imagine that the bottom line is going to be anything but negative for the industry, which means either shrinkage in the industry or raising prices one way or another, which puts them in a squeeze if there's a limitation on the extent to which they can raise prices.
Yeah, I mean, again, it goes into the full business cycle and speculation on what might happen. In the current climate, they've elected that they're going to manufacture here. They see the incentives that are fixed in the bill. It offsets the tariffs, but so when it comes to capital project execution and putting these assets in place, it's much more now a dynamic between finance and engineering in building facilities, because it's very careful cost segregation in order to take advantage of these taxes. So it does add a layer of complexity to the execution, but overall the speculation is that tariffs increase the total installed cost of a biotech facility maybe 1% to 2% on TIC, which is a significant number. And by using the benefits of the bill and the tax incentives and deductions within the bill, they can see a positive 3 to 5% on the TIC. So,
And how about imports of API from places like India and China and so forth, the impacts of tariffs on those sources? Yeah,
it's a good question, and there's also, there's a lot of investment in API production in the United States now. So, this is in process. The bill really didn't drive all of it. The reshoring efforts started when they realized supply chains were broken back in, early 2020. It's always a business decision, but it appears that the business decision is going with manufacturing here.
Yeah. And obviously there's a reason we get the API from those places, because it's less expensive. And I'm not sure to what extent the less available in the U.S., but let's put that aside. Just again, it's being manufactured in those places because we can get it cheaper. Now, it's as a national security issue, you can make an argument that there's something to be said for being as independent as we can be with regards to medicines. So HHS Secretary Kennedy, at his confirmation hearing, pledged not to alter the vaccine schedule and to work within the current vaccine approval and safety monitoring systems, and not establish parallel systems, and to, quote, maintain the Centers for Disease Control and Prevention Advisory Committee on immunization practices without changes. Then he unilaterally fired all 17 members of the CDC's Advisory Committee on Immunization Practices and canceled $500 million in mRNA vaccine development contracts impacting research teams and proposals. And last week, he was grilled and severely criticized, you may have seen this, by members of the Senate Finance Committee, including Senator Cassidy, who's a physician and who was pivotal, obviously, in Kennedy's confirmation. So the question is, how will Secretary Kennedy's controversial management of HHS impact life science companies, and particularly vaccine manufacturers? And I ask for your thoughts on that, Maria.
I don't know, candidly, I don't know that we're going to see much more. We will see an impact over time as the determinations and decisions start to take effect. But in my opinion, I think we've seen the most sweeping changes thus far when it comes to vaccines. I think at this stage, we know where he's at, how he's going to implement to a certain extent. But I think the challenge is he does have a very high level of skepticism for vaccines, to put it mildly.
Very mildly.
So by its very nature, we are going to see a heavy impact on the industry. We're already seeing that with the changes in guidelines when it comes to COVID-19 vaccines, who's in scope or not, especially when it comes to children. The fact that I want to say it's the APA came out with different guidelines for children than CDC. So there are, and that's going to be very case specific into different practices, how they're choosing to implement and which guidelines they're going with. We're going to, in terms of point of service vaccines such as Walgreens and CVS, whether or not that flexibility will remain, it's all going to have an impact on the industry, both on demand and access. And I think, candidly, the COVID-19 situation is likely to serve as a model on what we can see with other vaccines that may be similarly impacted. And again, the question becomes, with the skepticism and potential changing of CDC guidelines and impact on commercial insurance plans, what does that do for demand and pricing? I mean, it's really going to be a bottom line situation, but I think we can learn a lot of lessons from COVID-19.
I will share my sense of the inside baseball of all of this, if I may. And this will probably illustrate my biases, but when President Trump nominated RFK for HHS secretary, I said there's no way in hell that guy's going to be confirmed by the Senate. There are 4 Republican physicians in the Senate, not the least of which is Senator Cassidy, who has a long time history focused on vaccinations. And so not to worry, he's not going to get confirmed. In the second impeachment trial, Senator Cassidy voted to convict Donald Trump. And that earned him a condemnation by the Louisiana Republican Party, and it also earned him a primary opponent, who at the time of the confirmation process, I believe, was ahead of Cassidy in the polls. This is pure speculation, but I think it's pretty clear that Cassidy, even though he had challenged challenged RFK in the confirmation hearing and got various somewhat assertions that he would be a good boy. Cassidy felt under pressure politically to cast his vote to confirm RFK, and had he gone the other way, I think he would have taken others with him. He went out on the floor of the Senate and said, RFK has made all of these assurances for me, and I'm going to monitor him very carefully. And then Kennedy really betrayed him over and over and over again in the process in the coming months. So if you watched, and I did the hearing last week, I thought that Senator Cassidy laid a very clever trap for Kennedy, because I believe that Cassidy feels embarrassed and betrayed by the way he conducted himself in this process. And so he began by saying to Kennedy, don't you think that President Trump deserves the Nobel Prize for Operation Warp Speed? And Kennedy jumped on that and said, absolutely he does. I completely agree with you. And then Cassidy said, well, then why the hell have you been undercutting the COVID vaccine left and right ever since then? Not quite in those words, but that's the gist of it. And I think that what he may have been trying to do, and may or may not have succeeded, is drive a wedge between Kennedy and Trump, so that Cassidy can say, look, he's, your Nobel Prize candidate maybe for warp speed, and then Kennedy, your HHS secretary, has been undermining your credibility and the value of what you did with warp speed. So stay tuned. President Trump has proposed a 40% cut to the NIH budget. He froze billions of dollars in grants and canceled thousands of grants that were already in progress. Thousands of grants focusing on diversity, equity, and inclusion, health disparities, and LGBTQ health have been canceled. The NIH staff has been reduced by 2,500 people. Universities have had their grants frozen based on allegations related to responses to anti-Semitism, curriculum, and governance. And obviously, a key reason that the U.S. has led the world in biomedical innovation is our investment in basic sciences, which provides the scientific foundation that supports applied science and of drug development. These actions are being contested in federal courts. So for Anjali, how are these cutbacks likely to affect our ability to prevent, treat, and cure diseases?
Great question. I think so I'm a basic scientist, a basic neuroscientist, and one of the things that I'll start with, what has been, with regards to this bill, what I have learned the most, and the message that you would have gotten from today, is the fact that how interconnected everything is. And I have to say that that's been the biggest education for me. You talk about the patients and the new bill, all the way down to how it impacts basic science. It has been a huge jolt to academia. We heard a lot from Dean Epstein, which was excellent. And I will say, in the theme of optimism, so what I'd like to, just in a few sentences, in the theme of optimism, after the jolt, one of the biggest things that for me has been, I would call it as a way of taking a pause and really thinking about, so there are a couple of areas that we're really badly hit, which one is basic science being the foundation for therapies and therapeutics. The second is really educating our next generation of scientists, and not just scientists who stay in academia, but they feed into a variety of different spaces. So these are two areas that I've been thinking about as a leader in academia. I've been thinking about, and in the context of this forum with biotech and pharma, how are we really going to think about areas such as what are the barriers? For example, with academia and industry relationships, taking a pause and thinking about what are the barriers, and this was mentioned before, and for us to come together in ways in which we can increase sponsored research, ways in which we can do better with clinical trials. So those are areas, and a lot of the things, I think what I'd like to share today is really, and forums like this are excellent to start that conversation. So that's one. The second area is our trainees and capacity. Capacity, now the concern really is not just capacity building, is just sustaining capacity of our trainees. Could we be, now's the time for us to be thinking about programs where is it possible for industry and academia to come together and really think about programs that can enhance the learning of our graduate students, of our of higher education. So that's another area that I would love to continue a conversation on. And the third thing, which actually has not been mentioned, which has always been on my mind, and by the way, I'm new to Philadelphia, so it's really nice to come here. It's an excellent community. I'm a transplant from New York City. But one thing that has not been discussed is community and community engagement. And I'm at the medical school at Temple University, and I am an addiction neuroscientist. And I think that's another area that needs to be really thought about, because that kind of relationship between academia, to some part industry, and community, I think is also going to be really, really important. So even though it's a hard time for us, this is the time to pause and really build on the relationships. And so thank you for having me here.
Oh, sure. So I think one thing that's going to be interesting is that the fiscal year closes in 3 weeks from now. And the big question in Washington is, will there be a continuing resolution for a while? Will they actually be able to come up with some kind of a budget deal? The last time around, there was Senate Leader Schumer, Minority Leader Schumer, was criticized heavily because he agreed to not have a government shutdown. But then what we've seen after that is a lot of the appropriations and what it was agreed to back then have been rescinded and not spent, and a lot of that includes NIH funding. So I think what's going to be interesting to watch is whether, as this appropriations process unfolds over the next months, will the Democrats say, if you want us to make a deal on a spending program for the next fiscal year, you've got to put ironclad guarantees in there that the money that we actually vote for will actually be spent in the ways that we intended to do that. And by the way, we also want to unrescind the money that we voted for in the last fiscal year. Now, it's going to be more easily said than done, but I think it will be an interesting constitutional clash to see whether or not the Congress is willing to stand up to its most important role, and that is the control of the purse. Let me turn to you, Bridget. You're our tax specialist. I'd like for you to expand on what you think the most significant impacts of the One Big Beautiful Bill will be on life sciences regarding the tax provisions.
Absolutely. I'm not just saying this because of the room that I'm in, but undoubtedly the deduction of research and development costs is going to be the most favorable outcome. So prior to TCJA, companies in life sciences and really any company doing any research and development, or maybe not as applicable in this room, but people who are developing apps for phones, computer software, all of those costs were eligible for a deduction, and meaning you expense them in the year that they were incurred. With TCJA in 2017, there was this provision about Section 174 that you had to then capitalize these costs and amortize them over either a 5-year recovery period if they were domestic or 15 years if they were foreign. When this came about in 2017, I think nobody in this room thought it was going to stick around until 2022. And here we were having these conversations starting in maybe 2020, thinking it's going to get fixed. It's going to get fixed before then. And lo and behold, 2022 came around, no fix. 2023, we thought maybe something retroactive. And then we got to 2024 and we thought, this is it. We are just stuck with this now. And the One Big Beautiful Bill Act allows for companies to begin deducting those expenses again in 2025 in the year that they're incurred. Your expenses that were capitalized and amortized from 2022 to 2024, you can either deduct them on your 2025 return or your 2025 and 2026 return. This is really, this allows for some fungible cash management when you want to save the tax impact from those. And if you are a qualified small business taxpayer, which is based on gross receipts, it's a $31 million test from an average of 2022 through 2024. You can amend your tax return from those periods to as if you deducted the costs on an original filed return. All that to say, those are that's an option. It's not necessarily the right thing to do. If you didn't pay tax on a 2022 return, do you really need to amend to take more deductions? If you had a change in ownership, if you had a sale, and now you have net operating losses that are captured by Section 382, which limits your ability to utilize those net operating losses, you probably don't want to push more losses back into that period. So a lot of companies, by the way, I work for EisnerAmper, we're a public accounting firm. A lot of companies out there are recommending everybody should amend. This is this amazing act. Everybody should amend. But you really have to look at your specific situation and say, is this the right thing? There's also, as somebody who deals with the headache of amending returns, I can say it's a headache. It's not as simple as changing a couple of numbers and resubmitting a form. And another step back, this is just federal, and here we're sitting in Philadelphia, but there's 50 states to consider that a lot of people are filing tax returns in, and we have a variety of outcomes and how that's going to work. Certain states follow the federal rules on a rolling conformity, so now that there's been a change in the federal rules, those will apply for the states. Others have fixed state conformity, so if they conformed as of let's say 1/1/2022, they will not adapt this change, this favorable change. And other states pick and choose things that they want to decouple from. So I think it's a great outcome for the people in this industry and for taxpayers. It's going to be something that is interesting to see how people handle, the timing of those returns and the timing of those deductions.
And it'll be important to see to what extent those positive tax fixtures in the bill will compensate for the other factors that are going to raise their prices and their costs. We have about 6-7 minutes left, and I see we have a question right there.
Thank you for a great panel discussion. Thanks for chairing it, Jim. I want to just go back to some of the earlier comments. And first of all was the effect on the viral outcome and the vaccine piece. just to give you a sort of commentary, one of the things that Bracken does, we have a marketing services or a marketing agency team. We were building for a client that was putting a CDMO into New England area, a whole marketing area for vaccine development. They withdrew it this year and took it all offshore, and it's all gone back to Europe. So just give you that example, they've just dropped out of the US market, so that's an N of 1. The other, I was in the UK a couple of weeks ago, and people were complaining about the cost of drugs being increased. And I was assuming, but I don't know if your opinion would be the same, that that's actually part of the outcome of this. If you're going to look for favoured nation status of dropping the price to the lowest level of the competitive nations, what would you do? I'm assuming that's what's going on. I'd value your opinion.
Yeah, well, it's hard to say because it's speculative right now. And as I said, even though, I mean, Trump has never, at least publicly, been a friend of the industry. You know, if you remember in his first campaign, big farmers getting away with murder, and we're going to lower prices. In fact, he said, I think he claimed he's already reduced prices by as much as 1,500%, which means we're going to have to pay, the drug companies are going to have to pay the patients in order to take their medicines. But as I said, I think that in the case of that most favored nation thing, I do not believe that it will hold up in the courts if he tries to actually do it, because he does not have, I don't see any way that he has the authority as President of the United States to tell drug companies what their prices are going to be. That's a function of Congress, and I don't think that there would be the votes in the Congress to do that. Yes, ma'am.
Yes, so thank you. That was a great panel, all of you. You've mentioned Congress several times in your remarks, and a lot of this, disagreement is finding its way to the Supreme Court, which is accepting cases, or issuing rulings from this emergency docket, very short, not necessarily dealing with the content of what the question is, and deciding largely on procedural grounds, but the end result of all of this is giving Trump a pass on a lot of what he's doing. And not only is that confusing the judiciary right now, because there was a judge in Massachusetts, for example, that just got scolded by 2 of the justices of the Supreme Court for not following what they had issued in these short rulings. But with request to the grants that have been rescinded, this is really leading to a question of congressional power. And if it goes to the Supreme Court and there's, kind of a pass again, what do you think is going to happen?
Well, that's not what I think. I know exactly what's going to happen. I'm just kidding. There is an ilk of people in this country, and I think Project 2025 was in significant measure built around it, which is the Article 2 notion of government, that presidents have almost unlimited power. And we've seen this over time be adjudicated and debated, but there are, I would say that at least some of those members of the Supreme Court lean that way. And I find that disheartening, because I don't think that's what the Constitution says at all. And in fact, so the powers of Article 1, the Congress, and the Congress was constituted the way it is to be the most representative. You have 535 people in the Congress to represent all of the different communities and subgroups of our country. And the president gets elected, but he actually is not that representative. And in fact, he represents basically about half the people in the country who voted for him. So I suspect that I think you have to look at the Chief Justice, Roberts, to see how far he's going to let this Article 2 emphasis that many hold to be constitutional. And I hope and pray that there's a limit. I sense that somewhere he's going to say enough is enough of this. You know, we have to live up to our responsibility as the court to actually interpret the Constitution the way the founders intended it to be read. One more question, or a couple of questions. I'll leave it up to you, Nancy.
Thank you. So this was a great panel. Thank you very much. I learned a lot, and I was interested in the API manufacturing, kind of the processes, operations moving stateside. I'm thinking of the environmental impact of such large-scale manufacture as well, because a lot of it has been carried out by countries such as India and China, and there is a health cost there for those countries. So when we are talking about making drugs cheaper by manufacturing here, looking at how the EPA is getting also gutted, a lot of their research programs are impacted. I would like to know what's the impact really on drug costs and generics as we see the effect of all of these sort of things in manufacturing.
Kevin, you want to take that?
Little outside of my wheelhouse, but yeah, I mean, there's more regulation involved in manufacturing in the United States. That hasn't changed. We're obviously a proponent in the U.S. of bringing everybody else up to that standard. So it's going to impact capital costs to a certain extent. It's going to impact operating cost. Again, it's just a question of the look ahead for each company to determine if meeting those regulations is, enough to attract the business here. And those are all factors that go into those decisions, not only to just bring it to the U.S., but where in the U.S. do you bring that type of API manufacturing? And there's certain spots in the U.S. that seem to be very conducive to it, as that's where folks are setting up. But again, the goal is obviously not to gut the EPA to the point where we forget the environmental standards. That's not where industry is going with it. In fact, I mean, the push is really to bring everybody else, India, China, and other actors up to the same standard.
Thank you.
I think the thrust of what the president's trying to do with all of this tariffs and bringing manufacturing back to the U.S. is to create more jobs, and that's what it's all about. He wants to create more jobs, and I'm not an expert on the manufacturing of API, but I can't imagine it's a particularly labor-intensive industry. And it seems to me you could say, okay, all these boatloads and boatloads of API that comes in from India and China and elsewhere are now going to be made here. I have a sneaking suspicion it can be made by robots, more so than that it's not a high labor-intensive industry, nor is it, I imagine, one that pays a lot in way of wages. So I'm not sure, except for the idea of being more self-sufficient for national security reasons. I'm not sure that it's a winning objective. Shall we call it a day? All right, thank you very much. Thank you, panel.